Doctors say that it can be hard to predict the fertility of women after they undergo chemotherapy. And according to one East Texas fertility doctor, many women are not properly informed about fertility preservation options prior to beginning chemotherapy. East Texas News' Shaylee Sanders spoke with an expert about what women need to know before starting cancer treatments.
The American College of Clinical Oncologists just released a paper, and it was really pitiful to note that less than 25% of the oncologists actually address fertility preservation with their patients, if at all.
Dr. Anil Pinto says he will see women within 24 hours of being diagnosed with cancer to discuss fertility preservation options prior to beginning chemotherapy.
The majority of the chemotherapeutic agents would essentially render women sterile.
He says thanks to new medication, harvesting eggs can be done within about 2 weeks of the initial office visit, so women do not have to put off beginning chemo for too long. Dr. Pinto says harvesting eggs is an outpatient procedure that requires a lot of thought and a conversation with his on-staff psychologist.
There are many moral, ethical, and religious issues that need to be addressed. For instance, what if a patient does not survive her cancer? In that event, what do we do with the eggs? A couple might decide to fertilize the eggs. Now we have embryos. Embryos essentially have life. What do you do with these embryos?
He says while freezing embryos has been practiced for 3 generations, egg freezing is relatively new and more research is needed to know how long harvested eggs will last. However, he says he's had success with both.
95% of the eggs will survive the freeze and thaw, and the pregnancy rates are equivalent to as if we are doing a fresh IVF cycle down the road.
He says as technology advances, the procedures become easier, and it's important for doctors to share these new options with their patients before they move forward with chemotherapy. Shaylee Sanders, East Texas News.
Dr. Pinto says not all chemotherapy agents will cause infertility, but sometimes his patients just don't want to take that risk. He says it's also important for men to be aware of their fertility preservation options, which have been researched for years.